Good morning all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about cardiac arrhythmias and their drugs. So what is arrhythmia? Arrhythmia means it is a deviation from normal pattern of cardiac rhythm. Means there will be a deviation during a cardiac rhythm. Okay. So what are the drugs in arrhythmias? So before going to antiarrhythmic drugs, we have to know about the action potential of cardiac muscle. Okay. So if you see here, this is the cardiac action potential. There will be total 5 phases will be there. That is 0, 1 phase, 2 phase, 3 phase, 4 phase. Okay. So this phase 4 will be resting phase. Okay. Here the MCQ main will be what is the threshold in resting phase. That is minus 85 to minus 95 millivolts. Okay. So here the MCQ, what is the resting threshold in resting membrane potential? What is that one? Threshold, this one is minus 85 to minus 95 millivolts. Next, coming to the phases, where next phase will be phase 0. Phase 0 will be happening mainly due to opening of sodium channels. Okay, that's why there will be rising this one activity. Once next after that one, there will be phase 1. In this phase 1, what will happen? It is happen due to opening of potassium channels. Phase 2 is happening due to mainly of opening of potassium channels along with calcium channel opening also. In phase 3, what will happen? The closing of calcium channels and there will be some leaking of potassium channels will be there in phase 3. In phase 4, what will happen? All those sodium, calcium channels will be get closed. There will be some leaky will be in the potassium channels. Okay. That's why they will have 5 phases. That is phase 0, 1, 2, 3, 4. Okay. So total 5 phases will be there. So here the MCQs mainly focus on what is the threshold in resting membrane potential, that is minus 85 to minus 95. If you see here, major cation, obviously phase 1, phase 2, phase 3, here phase 4 also, including phase 4 also, the major cation will be potassium. Okay, because 1 will be happening to do opening of potassium, in 2 also there will be potassium will be there, in 3 also potassium will be there, in 4 also some leaking will be there. Okay, so the major cation in the cardiac action potential is potassium. Next we will see in the drugs. So what are the classifications we will have in antiarrhythmic drugs? They will have 5 classes. First class is sodium channel blockers. In this one we will have 1A, 1B, 1C type. Next class 2 type, that is beta blockers. Class 3 is potassium channel blockers. Class 4 is calcium channel blockers. Class 5 is miscellaneous drugs. Okay, we will see each one following. So first class 1 agents, what are those? In class 1, mainly what are the electrolyte will be interfere? Sodium, correct. It interferes with activity of sodium channels. Normally, if you remember one thing, normally sodium have 3 types of channels. One is active channel, inactive channel, closed channels. Okay. So there will be different drugs acting on different phases. Active means open channels, inactive means this one. Next followed by closed channels will be there. So first one way will act on open channels. At the same time, some will be in potassium channels. So due to acting on potassium channels, what will happen? It will prolong action potential and it will precipitate torsady points, that is QT interval, prolongation of QT interval. So what are the drugs we will have in this group? That is quinidine and procainamide. In quinidine, it will cause synchronism and digitalis toxicity. Why means it will inhibit the elimination of or excretion of digitalis. So obviously digitalis toxicity will be there. Next, procainamide, it is a drug of choice for atrial fibrillation and WPW, that is Wolff Parkinson Wilson syndrome. Okay. So next group will have class 1B agents. In class 1B agents, it is mainly due to blockage of inactivated sodium channels. Okay. In 1A, activated sodium channels. Along with they will have minor property on potassium channels. So these drugs are more effective when heart rate will be faster. That time only these drugs are effective. So mostly in ventricular arrhythmias or tachycardia, those cases only these drugs are very beneficial. Examples of these drugs will have lignocaine, mexiletine, tocainide, phenytoin. Okay. Here main MCQ will focus on lignocaine. Lignocaine is drug of choice for ventricular arrhythmias, MI-induced ventricular arrhythmias. All those things will use lignocaine only. Next is phenytoin is anti-epileptic, but it is an alternative to lignocaine in digitalis induced arrhythmias. Next, tocainide will be there. It is one. It looks like 1C, but the major adverse effect with this drug is agranulocytosis. Okay. So next, in class 1C agents, they will have more sodium channel blocking. They will doesn't have that much effect on potassium compared with 1A 1B. Okay. So when they are having no effect on potassium, obviously action potential duration will be, they will have no effect on APD. Examples of this drug is N-canide, flecainide, propafenone. Okay. So these drugs main thing is they decrease Vmax, velocity maximum, okay, in partially depolarized cells. So fast response action potential will be decreased. So in these drugs, this flecainide will be used in whole WPW syndrome. So mainly WPW syndrome, how can we treat means the radio frequency ablation of aberrant pathways. That means ablation of that radio frequency, that means aberrant pathways will get, we will use radio frequencies to treat in WPW syndromes, okay, to ablate those pathways. Next drugs in this group is class 2 agents, okay. So in class 1 will have 1A, 1B, 1C. So next class 2 agents will be beta blockers. So beta blockers mainly, so in beta blockers mainly they decrease sympathetic activity, okay. So the decreased slope of phase 4 and conduction through AB node will be delayed. So they will be mostly useful in supraventricular tachycardias. Examples of these are esmolol, propranolol, metoprolol. Okay. So here the MCQ is, which is the short acting class 2 agent means esmolol. Okay. It is most commonly used in emergency conditions. Okay. In normally in casualties, if heart rate is not controlling, then we will use IV esmolol. Okay. Next group of drug is class 3 agents. These are potassium channel blockers. So mainly action potential duration will be happen due to potassium channel blockers only. So obviously when you are blocking potassium channel, the phase 1, 2, 3 it will get prolonged. So obviously action potential will get prolonged. So QT prolongation will be there. Here the main drug in potassium channel blocker is amiodaran. Okay, it is a long T-half drug, long half-life drug. Okay, so that means it is having a 3 to 8 weeks. So it has all three classes, means sodium blocking, potassium, calcium blocking, all blocking activities will be there. It is a widest anti-arrhythmic drug, contains iodine, so it will have two effects. One is hyperthyroidism, second is hypothyroidism also it will induce. Okay. So what are the major therapeutic uses? This one is prophylaxis of all arrhythmetics except torsades spinatus. Means because these drugs will induce QT prolongation, right? So other than QT prolongation, QT prolonged arrhythmias, we will use amiodaran. So side effects I already explained: hyperthyroidism and hypothyroidism. Hyperthyroidism due to it contains iodine. That's why hyperthyroidism. Hypothyroidism why means hypothyroidism there will be reuptake of this 3,3,T4 will get obstructed. So obviously hypothyroidism will be caused. Next is peripheral neuropathy. Myocardial depression will be there. Along with pulmonary fibrosis will be there, hepatotoxicity, and mainly MCQ is corneal deposits will be there. So when you are giving amiodaran, obviously there will be corneal deposition will be there, photosensitivity will be there. Okay. Next in this group will be, we will have beryllium. Beryllium is known as a pharmacological defibrillator. Okay. So this drug is main MCQ focus on what is a pharmacological defibrillator is beryllium. Next in this group we will have sotalol. It is a beta blocker drug and having class 2 and class 3. Class 2 means obviously beta blocker. Class 3 is potassium blocker activity. Next drug is ibuprofen. This is MCQ sotalol. Okay, drug which is having potassium channel blocker means in beta blocker drugs we have sotalol. Okay. Next ibuprofen. Ibuprofen is a structural analog of sotalol. So it converts atrial fibrillation to sinus rhythm. Okay. So we can use ibuprofen. Next is class 4 agents. Class 4 agents will be calcium blocking drugs. So they inhibit L-type calcium channels. In this we will have verapamil and diltiazem. Here main drug will be verapamil. It is a drug of choice for supraventricular tachycardia and prophylaxis of supraventricular tachycardia. But drug of choice of supraventricular tachycardia is adenosine. Okay. So that is different. If you see PSVT, paroxysmal supraventricular tachycardia, this drug of choice will be adenosine. For supraventricular tachycardia, we can go with verapamil. Okay. So next group is class 5 agents. In class 5 agents, these are miscellaneous group. In this one, we will have digoxin. This is a cardiac glycoside. Adenosine drug will be there. Magnesium along with atropine and potassium will be there. So obviously, digoxin can increase vagal activity, thereby decrease heart rate. So we can use in atrial flutter and atrial fibrillation cases. Then adenosine, it will opens potassium channels. So obviously, there will be this one will be there. Potassium controls the rate and hyperpolarization of AB nodes. So this is drug of choice for paroxysmal supraventricular tachycardia. Main thing. PSVT adenosine, SVT verapamil. Then the TF will be 10 seconds. So you should be given in a very fast. Okay. How to means we will kept a 3-way cannula. Then we will inject first drug. Then elevate the hand. Then give the this bolus, IV bolus like NS anything. So what are the antagonists we have in this adenosine receptor antagonist is theophylline. Okay. So next in this group we have magnesium. It is used in congenital and acquired long QT syndrome. Atropine, potassium, this also we can use sometimes as a antiarrhythmic agents. Okay. But other than this one antiarrhythmic, mainly we will have digoxin is important, and here main MCQ is adenosine, which is drug of choice for PSVT. That's all. Okay. So these are the drugs as used as a antiarrhythmic agents. Thank you.